Hello, I'm Esther Fieldgrass of EF Medispa, and I'm here with our leading plastic surgeon, Dr. Christopher Johnson, who's come all the way from Brazil, and he's going to talk to us this morning about his Brazilian butt lift. This is something that he specialises in, and why so many ladies are coming to him right now to get that butt enhancement. So, Christopher, first of all, tell us where you're getting the fat from.
Well, we actually can get the fat from different areas. It depends how much fat the person has, because actually they're going to be benefiting from two procedures. We're going to sculpt their body in different areas and use some of that fat or all of that fat to enhance the buttocks.
Wow. There's been a lot of mention in the press about how dangerous a butt lift can be.
Yes, when it's done by someone who's not experienced, and it could be really dangerous, especially if you put fat not in the fat layer but inside the muscle layer, because the muscle layer has a lot of it's very vascularized, it has arteries and veins, and that could be dangerous. If you put fat inside of one of those, you could have serious problems.
Okay. A quick question, how long did it take you to learn this procedure?
Well, I'm from Brazil. That's where I did my training, and with Ivo Pitangui, which is world famous plastic surgeon. And in Brazil, where, the bodies aren't really covered, maybe a month in a year.
Okay.
So that's, I think, why we grow so expertise in the body and the buttocks and all that. Women usually naturally have nice buttocks, so we have a lot of experience in that area. And so I've been trained for the past 20 years in that.
I've never asked this question before, but do men actually have it as well?
I've never noticed either, but no, I'm kidding. Yeah, men do, but men usually have less fat than women on the buttocks. It's something natural, it's anatomic, and it has to do with the sex, with the hormones as well.
Okay. But do they actually go in for the transfer?
Not really. Very few, but we have men sometimes come in, yes.
Oh, wow.
Yeah.
Okay. So let's go a bit more into this. A lot of women actually see these ridiculous, I call them ridiculous, butt transfers on social media.
Yeah.
Really enhanced.
Uh-huh.
Possible? Not possible? Is it just a filter on the camera? What's going on?
Yeah, I believe that's not possible. It's not natural. You have a lot of filters in Instagram or different social media, and you have different positions. We have many videos of people actually showing how they really are in real life and how they can look depending on the angle, on the position, on the lighting, and all that influences. So it's important for patients not to be tricked by what's not possible, and have realistic expectations.
Okay. So talk a little bit about the shape of the buttocks, because I know this is really important, and you're often talking in the clinic about what people are expecting and what can be achieved and what can't.
Sure. So what happens is, as we put fat in the buttocks, it's obviously going to take the shape of the buttock of that person. It's impossible to actually mold it as if it were clay. You can't do that. You can enhance some areas, but someone who has an anatomical buttock that is not so big, and depending on the quality of the skin, it's impossible to have those huge butts. And I personally don't think they're beautiful anyways. I think we have to give women proportions. That's more important. Looking good from the waist to the proportionate to the thighs, and that's more eye captivating than having just a big buttock and thin legs.
Yeah, that can.
It looks very strange.
It does look very strange. And I've noticed that with some of the photos that the actual buttock seems to start from almost the hip level. And that's very odd too.
It is odd. It's important that the surgeon that you look for knows his anatomy and knows what's possible, and just enhances the natural, beautiful features that each person has.
Okay. Do you actually need more fat for the buttock than you do for the breast? if you're enhancing the buttock? Is it
Yeah.
a bigger area?
It is. It is definitely. It is a bigger area. In the buttocks, we could put, for example, 500, almost 600 cc's per side, as opposed to the breast. Sometimes 200, 250 is already enough.
Are you finding that when people are coming in for what I call a butt lift, for want of a better word, that they're actually resculpting their bodies at the same time?
Oh yeah, definitely. Only by removing fat from the flank area and the back area, you're already projecting the buttock more, even if you don't add fat there, because you're actually sculpting. And so that's the thing. You make their body more harmonious, as opposed to before. Sometimes they're looking too much squared, and now you have like a more of a violin shape. That's what we call it.
Okay, that sounds fabulous. How long does this type of procedure take?
It depends on how much fat and how many areas we're actually treating and we're removing the fat from. But let's say 3-4 areas and the fat transfer takes 2.5 hours.
Wow. And the fat, do you just suck it out and put it back in, or what do you do?
Yeah. Actually, there's this device that it's connected to. It's a totally closed system, so there's no contamination, anything like that. There's this device that filters the fat that's being removed. It removes impurities that are in the fat and the liquid that we use to infiltrate before, and it gives us, in the end result, only pure fat, and that's the fat that we're going to use to put back in different areas, and especially the buttocks we're talking about.
Okay. Something people always ask me is that when you're doing a fat transfer and they put on weight, are they going to get fatter?
They will get fatter. Yeah, those fat cells are living cells. So what happens is when we eat a lot or grow fatter, the fat cells, they just increase in size and volume. So it will get fatter.
So if they've taken fat out from an area and they put on weight, will they put weight back on the areas where you've taken the fat out?
They will as well. That would be a good solution for obesity in the whole world. Imagine if that were possible, just to remove fat cells from one area and they never grow back. We would just liposuction everybody in the whole wide world, and they could eat and they would never grow fat again.
That's
but
me.
It's not possible.
I'm coming in for that one. Okay, that's great. Talk to me about the after effects of this. Is it sore? Are people sore? Is it numb? Are they bruised?
Well, usually you could expect to be a little bit bruised. It depends on the quality and texture of the skin. Sometimes really light skin people, they're more bruised than people who are fairly tanned. And in terms of pain, usually patients don't complain that much. Some don't even take the painkillers that we send them home. An area that sometimes they feel a little bit of discomfort, not so much pain, is the flanks again. And you could expect to be a little bit swollen in some areas. That's why it's important to come in for aftercare treatment. That really helps to enhance the results and takes the swelling away.
I know with one of my very close friends, that you actually did liposuction on her. She wanted the fat transferred to her buttocks.
Yes.
And you also did an abdominoplasty at the same time, tummy tuck.
Yes.
And she said to me, "Oh, Esther, can you look after me after I've had this done?"
Okay.
I went, "Sure." And she came to stay with me, and the next day there was no bruising there whatsoever, Christopher.
Yeah.
How did you do that?
Yeah, that's a combination, as I said, of the technique that we use. You know, we try to always evolve in our technique and thinner cannulas, and we use certain machines that help with the fat removal. And also some of it is from her genetics.
I was so impressed.
Yeah.
Yeah, that was amazing. Before somebody has this procedure done, obviously they have to come in and see you.
Yeah.
What are the pros and cons of having this done?
Yeah.
You know, for future times,
Sure.
or as they grow older, what's going to be happening to their body. And I know today it's most likely very fashionable to have the buttocks done.
Yeah.
But what if they decide afterwards they've made a mistake? Then what?
Well, it's possible to always remove fat that's been placed in some area. I can tell you that to this day, nobody came back to have their fat removed. So again, it's important to give natural results, not overdo an area or not overdo the buttock area and too much fat. So I try to stay always, in a safe line where patients are happy and they won't regret the procedures.
Okay. And you think in years to come, as the body gets older?
No problem at all. It's very important. That's one of the first questions that I ask patients when they come in for consultations, is if they work out and if they take care of what they eat, because that's really important. Why? If they come in for the procedure, have liposuction, go through all of the aftercare and all that, and they don't take care of their body afterwards, they will grow fat again, or it's not gonna have a long-lasting result. So they have to do their part as well.
Okay. After they've had surgery, do they have to go into compression garments? What are they wearing?
Yeah, compression garments are important. As soon as the procedure is over, inside the operating theater, the nurses dress them with the garments.
Mm-hmm.
They have to keep those garments on for the first whole month, only removing it for the aftercare treatments and for showering. And during the second month, they can opt to sleep with the garment and spend a day without it. So only 2 months, and that's it.
Okay. Contraindications for having this done?
Actually, they're not contraindications, only if the patient is not well in terms of health, or they have some problem or a cardiovascular problem, or if they're really extremely overweight, and then that's probably a contraindication. They should at least try to get near their more ideal weight. And
do you look at a BMI before you do this on a patient?
Yeah, we actually don't look at the numbers, but visually looking at patients, we can obviously tell. If someone's very overweight, they won't benefit from that procedure because they would have excess skin, and then we would either have to remove skin with some other procedure like a tummy tuck or something like that for them to be able to have a good result.
So Christopher, one last question. Is it possible to have fat transfer to the butt and to the breast at the same time?
Yes, it's possible. What we do is first we put the fat, remove the fat from different areas, put it in the buttock, and then we flip the patient over. The last thing we do is put fat in the breasts.
Okay.
Yeah.
And does that take much longer?
Well, it takes maybe half an hour to 45 minutes more.
Okay,
Yeah.
That's great.
Yeah.
So, ladies, if you're out there and you want to come and see Dr. Johnson to have a fabulous butt and even better breasts, then please give us a call on 0207 937 5554. Or if you want to find out more, visit our website www.efmedispa.com. Thank you.